Hello, everyone. I'm Dr. Jessica Clemens, and today I want to speak directly to those of you living with diabetes or caring for someone who is. You may be watching your diet, exercising, checking your blood sugar, and even taking medication, yet something still feels off. Your energy is low, your numbers fluctuate, and complications feel like they're always looming. What if I told you that one of the most overlooked keys to managing diabetes might not be in your medication bottle, but in your mineral intake? Yes, something as simple as being low in certain trace minerals can throw your entire system out of balance, making it harder for your body to use insulin, protect your organs, and manage inflammation. Today, I'm going to walk you through the 5 most essential minerals that every diabetic should be aware of. These aren't magic pills or trendy supplements. They are powerful, science-backed nutrients that support your body at the cellular level. So let's dive in, and by the end, you'll have a clearer path toward better energy, better blood sugar control, and overall better health. 1. Molybdenum. Molybdenum may not be a mineral you hear about often, but its role in the body is subtle and essential. For people with diabetes, it's like having a silent janitor constantly cleaning up the metabolic waste that builds up from high blood sugar. Molybdenum activates enzymes that break down harmful byproducts like sulfites and uric acid. Without enough of it, these toxins can accumulate and damage the blood vessels, kidneys, and nerves, all areas already vulnerable in diabetes. What many people don't realize is that even with a seemingly healthy diet, diabetics often have 20 to 40% lower molybdenum levels due to inflammation and higher urinary loss. That's why fatigue, poor detox, and inflammation may show up even when you're doing everything else right. Food sources like black-eyed peas, lentils, lima beans, oats, and beef liver are excellent. Just half a cup of black-eyed peas can give you more than your daily requirement. Although it's not something you typically supplement unless advised by a doctor, molybdenum works in the background, supporting your liver, pancreas, and kidneys. Think of it as your metabolic maintenance crew, quiet but vital. 2. Vanadium. Now let's talk about vanadium. This trace mineral is fascinating because it actually mimics insulin in the body. Yes, you heard that right. It acts like insulin, helping glucose enter cells even when your insulin response is impaired. In some small clinical trials, vanadium has helped reduce fasting blood sugar by up to 20%. It activates insulin receptors and helps regulate how much glucose your liver produces. But here's the catch. Most diets barely provide any vanadium at all, and its absorption from food is low. Mushrooms, parsley, black pepper, and shellfish contain vanadium, but not enough to make a therapeutic difference. That's why vanadium is usually studied in supplement form, specifically as vanadyl sulfate. However, I must caution you, this is not something to take lightly. High doses can cause digestive issues, and in people with kidney problems, it may do more harm than good. It should always be used under professional supervision. Still, when used wisely, vanadium may help lower blood sugar, reduce cravings, and even ease the burden on your pancreas by enhancing insulin sensitivity. 3. Selenium. Selenium is your body's internal antioxidant defense shield. It's involved in producing glutathione peroxidase, a master enzyme that protects cells from oxidative stress, one of the main causes of diabetic complications. Now, why is this important for diabetics? High blood sugar leads to constant oxidative stress, which damages insulin-producing cells in the pancreas, nerves, and blood vessels. Selenium steps in to slow that damage. In fact, studies show that selenium may reduce beta cell damage by up to 30%, delaying the progression of diabetes. It also supports thyroid hormones, which control your metabolism and insulin sensitivity. A small deficiency can worsen blood sugar control, while too much selenium may do the same. So balance is everything. The best food sources? Brazil nuts. Just one nut can meet your daily needs. Salmon, sardines, sunflower seeds, and turkey. These are bioavailable and easy to add to your diet. When supplementing, the safe range is usually 55 to 200 micrograms per day. More is not better here. Signs of overdose include brittle nails, fatigue, and a metallic taste. So keep your selenium in the sweet spot. 4. Chromium. Chromium is often forgotten, yet it plays a direct role in how your body uses insulin. It makes insulin more effective, helping glucose enter cells more easily and reducing those frustrating blood sugar spikes. The form we need is trivalent chromium, or Cr3+. It helps insulin bind to its receptors and do its job more efficiently. Studies have shown that chromium supplementation can improve insulin sensitivity by up to 30%. Here's the problem. Up to 90% of people in Western countries may not be getting enough chromium, especially those with diabetes. And since high blood sugar causes you to lose more chromium through urine, deficiency is even more likely. Beef liver, broccoli, eggs, and grape juice are good food sources, but absorption is low. Supplements like chromium picolinate are more effective, typically taken in doses between 200 and 1,000 micrograms per day. But please don't overdo it. Too much chromium can interfere with other minerals or stress the kidneys. As with all things in health, the right dose is the magic. 5. Magnesium. Now, let's discuss one of the most critical and commonly deficient minerals in diabetes, magnesium. Up to 70% of people with diabetes are magnesium deficient. It's the mineral that helps your cells respond to insulin, reduces inflammation, supports nerve function, and stabilizes blood pressure. Yet it's often overlooked. Magnesium loss increases with high blood sugar and insulin resistance. That's why it's so important to correct this deficiency. It helps break the vicious cycle. Studies show that magnesium can lower fasting glucose by 10 to 15% and improve A1C levels by about 0.5%. But the benefits don't stop there. Magnesium also helps with sleep, mood, hormone balance, and even fertility. The best food sources: pumpkin seeds, almonds, spinach, black beans, and avocados. These foods also contain fiber and healthy fats, which support blood sugar control. When food isn't enough, magnesium glycinate, citrate, or malate are excellent supplement choices. Doses typically range from 200 to 400 milligrams per day. Avoid magnesium oxide, which has poor absorption and may cause digestive upset. Correcting magnesium deficiency may be the single most impactful move you make in supporting your overall diabetic health. As we wrap up, I want you to remember this. Managing diabetes isn't just about cutting sugar or taking medication. It's about nourishing your body at a cellular level with the right support. These 5 minerals, molybdenum, vanadium, selenium, chromium, and magnesium, work silently behind the scenes, helping your body process glucose, repair damage, and reduce the inflammation that worsens diabetes every day. You don't need megadoses. You need the right balance, consistency, and a little curiosity about what your body may be lacking. So please talk to your healthcare provider about testing and exploring these minerals in your daily routine. Small changes in your nutrient intake can lead to big shifts in your energy, your stability, and your long-term health. If you found this video helpful, hit the like button and let me know in the comments which mineral surprised you the most. Don't forget to subscribe and turn on notifications so you never miss a video that could change your health for the better. Stay informed, stay healthy, and I'll see you in the next one.